Top 25 Nurse Midwife Interview Questions and Answers. Preparing for a nurse midwife interview requires more than knowing clinical procedures. Employers want to understand your communication skills, clinical judgment, compassion, professionalism, and ability to support women throughout pregnancy, labor, delivery, and postpartum care. In this guide, we cover 25 common nurse midwife interview questions and strong sample answers to help you prepare confidently. These questions address patient care, emergency situations, teamwork, ethics, education, and clinical decision-making. Use these answers as a foundation, but personalize them with your own experience, qualifications, and examples to create authentic responses during your interview. 1. Tell me about yourself and your experience as a nurse midwife. I am a compassionate and patient-focused nurse midwife with strong knowledge of pregnancy, childbirth, postpartum care, and women's health. My approach combines evidence-based clinical practice with emotional support and clear communication. I focus on creating a safe environment where patients feel respected and involved in their care decisions. I also work effectively with physicians, nurses, and other healthcare professionals. My goal is to provide high-quality care while supporting positive outcomes for mothers and newborns. 2. Why did you choose to become a nurse midwife? I chose nurse midwifery because I wanted to support women during some of the most important moments of their lives. I am passionate about pregnancy, childbirth, preventative care, and patient education. Midwifery allows me to combine clinical knowledge with personalized, compassionate care. I particularly value helping women understand their options and participate in decisions about their health. I find it rewarding to build trusting relationships while promoting safe pregnancies, healthy births, and successful postpartum recovery. 3. What are the most important qualities of a successful nurse midwife? A successful nurse midwife should demonstrate compassion, strong clinical judgment, communication, patience, adaptability, and attention to detail. The ability to remain calm during emergencies is also essential because childbirth can change quickly. I believe empathy is particularly important because every patient has different expectations, concerns, cultural values, and medical needs. A strong midwife also understands when collaboration or escalation is necessary. Combining clinical competence with respectful communication helps create safe and positive experiences for patients and their families. 4. How do you provide prenatal care to expectant mothers? I provide prenatal care by assessing the mother's physical and emotional health throughout pregnancy. I monitor vital signs, fetal development, laboratory results, nutrition, medications, and potential risk factors. I also discuss lifestyle choices, warning signs, birth planning, and preparation for delivery. Patient education is an important part of every appointment, so I encourage questions and explain information clearly. I maintain accurate documentation and communicate concerns promptly with the appropriate healthcare professionals when additional assessment or intervention is needed. 5. How would you handle a high-risk pregnancy? When caring for a high-risk pregnancy, I begin with a thorough assessment and carefully monitor the mother and fetus according to established clinical guidelines. I identify warning signs, review medical history, and communicate concerns promptly. I understand that high-risk pregnancies may require collaboration with obstetricians, maternal-fetal medicine specialists, or other professionals. I remain calm and organized while explaining the situation to the patient. My priority is always safety, early recognition of complications, coordinated care, and informed decision-making. 6. How do you support a woman during labor? During labor, I provide continuous assessment, encouragement, education, and emotional support while monitoring maternal and fetal well-being. I respect the patient's birth preferences whenever they are clinically appropriate and encourage effective communication throughout the process. I help the patient understand what is happening and discuss available comfort measures. I also watch carefully for complications and changes that require intervention. My goal is to create a safe, respectful environment while helping the mother feel confident, informed, and supported throughout labor. 7. How do you handle an emergency during childbirth? In an obstetric emergency, I focus on remaining calm, quickly assessing the situation, and following established emergency protocols. I prioritize maternal and fetal safety while communicating clearly with the healthcare team. I immediately identify the problem, initiate appropriate interventions within my scope of practice, and request additional assistance when necessary. I believe teamwork and communication are especially important during emergencies. After stabilization, I ensure appropriate documentation, patient communication, and follow-up care while reviewing the situation for future learning opportunities. 8. How do you manage a patient who is anxious about childbirth? I first listen carefully to understand what is causing the patient's anxiety. I avoid dismissing her concerns and instead provide reassurance based on accurate information. I explain the labor and delivery process in simple language, discuss available options, and encourage questions. I also support the patient's chosen coping strategies when clinically appropriate. Building trust is important because anxiety can affect the childbirth experience. My goal is to help the patient feel informed, respected, emotionally supported, and confident in her care plan. 9. How do you educate patients about prenatal nutrition? I provide practical, individualized education based on the patient's health status, nutritional needs, lifestyle, and pregnancy stage. I discuss balanced meals, hydration, appropriate supplementation, food safety, and healthy weight management. Rather than overwhelming patients with complicated information, I focus on realistic changes they can maintain. I also encourage patients to ask questions and discuss any dietary restrictions or challenges. If specialized nutritional support is needed, I collaborate with an appropriate healthcare professional to ensure the patient receives comprehensive guidance. 10. How do you handle a patient who refuses recommended treatment? I respect the patient's autonomy while making sure she understands the potential benefits, risks, and alternatives associated with the recommended treatment. I listen carefully to her reasons and provide clear, unbiased information without becoming judgmental or confrontational. I confirm that the patient understands the consequences of her decision and document the discussion appropriately. If the situation involves significant clinical concerns, I consult with the appropriate healthcare team. My goal is to maintain trust while supporting informed decision-making and patient safety. 11. How do you communicate with patients from different cultural backgrounds? I provide culturally respectful care by avoiding assumptions and taking time to understand each patient's values, preferences, beliefs, and communication needs. I ask respectful questions and listen carefully to the patient's perspective. When language barriers exist, I use appropriate professional interpretation services rather than relying on family members when possible. I also remain aware that cultural practices may influence pregnancy and childbirth preferences. My goal is to provide safe, inclusive, patient-centered care while respecting individual differences and professional clinical standards. 12. How do you handle disagreements with a physician or healthcare professional? If I disagree with another healthcare professional, I remain respectful and focus the discussion on the patient's safety and clinical needs. I explain my concerns using objective information, assessment findings, and relevant clinical guidelines. I listen to the other professional's perspective and try to reach a collaborative solution. If a serious safety concern remains unresolved, I follow the organization's escalation procedures. Professional disagreement should never become personal. Effective teamwork means communicating openly while keeping the patient's best interests at the center. 13. What would you do if you suspected postpartum hemorrhage? If I suspected postpartum hemorrhage, I would immediately assess the patient, recognize the severity of the situation, and initiate appropriate emergency measures within my scope of practice. I would call for assistance, monitor vital signs and bleeding, and follow established postpartum hemorrhage protocols. Clear communication with the healthcare team would be essential. I would support timely treatment and escalation while reassuring the patient and family. Accurate documentation and continued monitoring would also be important after the immediate emergency is addressed. 14. How do you provide postpartum care? Postpartum care involves monitoring physical recovery, emotional well-being, breastfeeding or feeding concerns, pain, bleeding, vital signs, and potential complications. I educate mothers about warning signs that require immediate medical attention and discuss recovery expectations. I also provide guidance regarding newborn care, nutrition, contraception, and follow-up appointments when appropriate. Emotional health is equally important, so I assess for concerns and encourage patients to discuss how they are feeling. My goal is to support a safe recovery and a confident transition into motherhood. 15. How do you support breastfeeding mothers? I support breastfeeding mothers by providing practical education, encouragement, and individualized assistance. I assess positioning, latch, feeding patterns, and potential concerns while recognizing that every mother and baby may have different needs. I avoid judgment and respect informed feeding choices. If a mother experiences difficulties beyond my expertise, I collaborate with lactation specialists or other appropriate professionals. I also reassure mothers that asking for help is normal. My focus is supporting healthy feeding, maternal confidence, and the well-being of both mother and baby. 16. How do you prioritize tasks during a busy shift? I prioritize tasks according to patient safety, clinical urgency, and time-sensitive responsibilities. I first address emergencies or patients showing signs of deterioration, followed by important assessments, treatments, documentation, and routine responsibilities. I continuously reassess priorities because patient conditions can change quickly. I also communicate with team members and delegate appropriate tasks when possible. Staying organized, maintaining accurate documentation, and avoiding unnecessary delays help me manage a demanding workload while ensuring that every patient receives safe and attentive care. 17. How do you maintain accurate patient documentation? I maintain accurate documentation by recording assessments, interventions, patient responses, communication, and relevant clinical information promptly and objectively. I avoid assumptions and use clear professional language. I understand that accurate records support continuity of care, patient safety, communication, and legal requirements. I review documentation for completeness and correct errors according to organizational procedures. I also protect patient confidentiality at all times. Good documentation is an important part of professional nursing and midwifery practice because it provides a reliable record of care. 18. How do you handle a difficult or angry patient? I remain calm, professional, and respectful when dealing with an angry patient. I allow the patient to explain her concerns without unnecessarily interrupting and acknowledge her feelings. Once I understand the issue, I explain what can be done and clarify any misunderstandings. If I made an error, I take responsibility and follow appropriate procedures to address it. If the concern requires additional assistance, I involve the appropriate supervisor or team member. My goal is to resolve concerns while maintaining trust, dignity, and patient safety. 19. How do you stay updated with developments in midwifery? I stay current by regularly reviewing clinical guidelines, professional resources, research findings, educational materials, and continuing professional development opportunities. I also learn from experienced colleagues and participate in relevant training when available. Healthcare practices continue to evolve, so I believe ongoing education is essential for safe and effective patient care. I make an effort to evaluate new information critically and apply evidence-based practices appropriately. Continuing education helps me maintain professional competence and improve the quality of care I provide. 20. How do you handle ethical issues in midwifery? When facing an ethical issue, I focus on patient autonomy, safety, dignity, confidentiality, informed consent, and professional responsibilities. I gather accurate information and consider the patient's wishes alongside clinical recommendations and applicable policies. If the situation is complex, I discuss it with senior colleagues, physicians, or an ethics resource when appropriate. I avoid making personal judgments and ensure that communication remains respectful. My objective is to make decisions that protect the patient's rights while meeting professional and clinical standards. 21. Describe your approach to patient education. My approach to patient education is clear, respectful, and individualized. I first assess what the patient already understands and identify areas where additional information is needed. I avoid unnecessary medical terminology and explain important concepts using practical examples. I encourage questions and confirm understanding rather than assuming the patient understands everything discussed. I also provide appropriate written or educational resources when available. Effective education empowers patients to make informed decisions, recognize warning signs, follow care plans, and participate actively in their health. 22. How do you work effectively as part of a healthcare team? I believe effective teamwork requires communication, respect, accountability, and a shared commitment to patient safety. I communicate important changes promptly, listen to colleagues, and contribute relevant clinical observations. I am comfortable asking for assistance when necessary and supporting coworkers when workloads become demanding. I also respect the expertise of different healthcare professionals and understand the importance of clearly defined responsibilities. Strong teamwork reduces misunderstandings and improves continuity of care. Ultimately, collaboration allows us to provide safer and more comprehensive care to patients. 23. How would you handle a suspected case of domestic violence? If I suspected domestic violence, I would prioritize the patient's immediate safety and provide a private, respectful environment for discussion. I would ask appropriate questions without judgment and listen carefully to the patient's responses. I would follow organizational policies, legal requirements, and safeguarding procedures regarding assessment, documentation, reporting, and referral. I would avoid pressuring the patient and provide information about available support services when appropriate. Maintaining confidentiality and safety is essential, while ensuring that concerns are handled according to professional and legal responsibilities. 24. What would you do if you made a clinical mistake? If I made a clinical mistake, I would immediately prioritize patient safety and take appropriate action to minimize potential harm. I would notify the relevant healthcare professional or supervisor according to organizational procedures, and provide honest, accurate information about what happened. I would document the incident appropriately and participate in any required reporting process. I would also reflect on the cause and identify ways to prevent recurrence. Taking accountability demonstrates professionalism and helps create a safer healthcare environment for both patients and staff. 25. Why should we hire you as a nurse midwife? You should hire me because I bring compassion, clinical responsibility, strong communication, teamwork, and a commitment to patient-centered care. I understand that every pregnancy and birth experience is unique, and I strive to provide respectful support while maintaining high clinical standards. I remain calm under pressure, communicate effectively with healthcare teams, and prioritize patient safety. I am also committed to continuous learning and professional development. I would bring dedication, empathy, reliability, and a strong desire to contribute positively to your healthcare organization. A successful nurse midwife interview requires preparation, confidence, and the ability to demonstrate both clinical knowledge and compassionate patient care. The 25 questions covered in this guide can help you prepare for topics involving prenatal care, labor, emergencies, postpartum support, communication, teamwork, ethics, and patient education. Remember that strong interview answers should sound natural rather than memorized. Whenever possible, include examples from your own experience and explain the results of your actions. With thoughtful preparation, professional communication, and confidence in your abilities, you can make a strong impression during your nurse midwife interview.